Hi class, my name is Natasha and I'll be discussing age-related particularly as it applies to older adults. People encounter age-related stigma on a daily basis. As irresponsible and rebellious, middle-aged people are seen as desperately trying to hold on to their youth, and older people are prejudged as senile. As a society, we like to judge a book by its cover. We don't like the unfamiliar, so we have preconceived notions for just about everything. The truth of the matter is, however, that everybody has a different approach to aging, and these stigmas unfairly label people. Nevertheless, the fact doesn't stop people from prejudging each other based on their age. Of all the victims of ageism, it's probably older adults who experience it most heavily on a regular basis. Their experiences of age stem one of the good intentions, such as in receiving unwanted help from a stranger, to more harsh ones, such as being denied employment based on age. Each of these categories of stigma is especially relevant to older adults because signs of aging are viewed negatively in today's youth-obsessed society. For example, minor lapses in memory in older people is viewed as dementia, when in reality we can be forgetful at any age. The stereotype content model provides a unified view for understanding stereotypes about most groups. This model details two key categories under which group stereotypes fall: warmth and competence, perceived by others as high on both, low on both, or high on one and low on the other. Data support model has shown that older adults are viewed as having little power within society and uncompetitive with other groups for resources. As a result, they are perceived as warm but incompetent. This model predicts that warm targets such as older adults will experience active facilitation. Typically, abilities contrast greatly from the perceptions others have of them. Older adults feel younger than their chronological age. An example, older adults feel younger experience higher life satisfaction and more positive health outcomes. The relationship between more perceived control and more positive health outcomes has also been consistently demonstrated in more recent research. On the other hand, a relatively body of research has shown that older adults' capability worsens when they're directly exposed to negative age stereotypes. Older adults may experience being excluded and disregarded in various situations. All in all, describing the older target as competent failed to have a positive effect, and the older target was continued to be seen as relatively incompetent across all conditions. Unfortunately, these concerns can mess with their performance and, ironically, information. There's a huge amount of literature showing that older adults' function can be negatively impacted by the age stigma they face. The relationship between more perceived control and more positive health outcomes has also been consistently demonstrated in more recent research. For example, an older person confronting someone for using patronizing language, and an older adult might explain the patronizing speech he or she is experiencing to the speaker as ageist. By making an attribution of age prejudice, the older adult is able to protect his or her self-esteem by concluding that there is nothing about himself or herself which deserves this kind of treatment, but rather the speaker's prejudice toward older people. Another coping strategy older adults may use involves disengagement. For instance, if an older adult avoids a grocery store clerk who he or she has found to be condescending on past visits to the market. In this presentation, I identified different forms of age stigma by differentiating between benevolent versus ageism, and how older adults might cope with the stigma arising from each other. The effects of age-related stigma on older adults was discussed, especially in terms of their function. Descriptive age stereotypes that portray older people as warm but incompetent often lead to treating older adults being treated better and vice versa. It is important to understand and apply these findings to ultimately reduce age stigma and its impact on older adults.